everybody, my name is Arina and today we're gonna work on our knees. I've been asked a lot of times how to work on the knee joint, especially when you are in pain. And I always share a few exercises that I used to do when I had a surgery on my knee. I had the cruciate ligament that was completely broken and then it was replaced. And I was very lucky with an amazing physiotherapist who helped me a lot. I am not a physio, I'm not a doctor, so please, in case you are in a lot of pain or you suffered an injury, of course, contact a doctor, contact a surgeon, contact a professional physio. Here are just some suggestions that I know that helped me, that some other dancers did those exercises, and hopefully they won't harm, and I'm pretty sure they won't. But again, be very conscious about what you're doing, and always, it's very personal. Maybe they won't work for you. I would not exercise if you are really inflamed. Let the swelling go down. But if you just experience that your knee joint is weak, you need strength, it's cracking a lot, it's stiff, it's very good to exercise. Now, first of all, this idea of giving rest when you just have some pain is actually not the right idea. If you don't want to train your knee because you feel like, it's very sensitive, don't. Go follow your instinct, as I said. But then train the rest of your body, train your abs, train your back, train your hips, train your feet, your shoulders, whatever it is. Keep on training, keep on the blood circulating, the energy flowing. But when you're ready to start training your knee to get back after a surgery or after an injury, after you've been isolating your leg or not using it so much, we can start with a few very, very simple exercises. And we'll be on the chair. So I will use this fancy roller. And what you can do is just to push it forward and bring it back. It might be that you can't really bend your knee over 90 in the beginning. So why is it good? So you can really find a stretch and bring it in and see how much you can bring it in. So if you can push a little bit, force a little bit over the pain and just do it like this. It's not about many repetitions, as you can imagine. It's really about using the muscles to bring it out and bring it in, using inner thighs, keeping your back nice and straight, and stretch and in. I would start with maybe 10, 15 of those. Give it a break. If this is too difficult in the very beginning, if you're very stiff in your knee, you can just do it with a towel. If this is how much range you have in the beginning, that's fine. Let it slide while I'm doing it on the towel, so I don't have the resistance with the floor, so it's sliding. Yeah, you can also use just the empty wine bottle. You don't have to have a fancy equipment, so you just roll the bottle, you know, but I have a roller, so lucky me. Next part we're gonna do on the little carpet. So next time I've moved on to the mat, and you can do some stretching and flexing. So you can just bring the heel towards the thigh. Obviously, if your knee been very swollen, it will be a small range, something like this. And slowly you can just do a small pushes towards the thigh and then let it relax. And a few times, maybe just 4 or 5 times. And then if it's maybe like this, my knee was really, I couldn't stretch it, so you can just slightly controlling stretch and relax, stretch and relax again Once this is done and this is easy, then you can grab your toes and just use, you almost don't press, you only use the gravity, so you let the leg hang into the hand and just slightly lengthen underneath those muscles and ligaments, and lengthen in. Now here again, you can take the roller and you can push and bring it in. It's a different muscle use. You can even use both legs. So like this, you can, for example, let your arms go, and this is also a little bit of the ab exercise. Yeah, so now I'm not doing it so good because I'm opening my knees, the preferably you keep the knees aligned with the here. So the more controlled the movement is, the better it is. You can really try to, maybe with a good foot, you can try to bring this leg in and then stretch it out. And for example, my range is here, so I use the other foot to bring it a little bit in and stretch it out. Next would be, so we strengthen these muscles. We can take our towel again, or a sock, or whatever you want, and you can grab it with your toes. Oh, I need to, and place it. Grab it with your toes and place. Really spread your toes, pick it up and replace. Spread your toes, pick it up and replace, and replace, and replace. Always when you do it, try not to sink too much down. Really keep your back open. Last exercise that we can do for our knee when it's in quite a lot of pain or still restricted. We're working on the back side of our leg. So on the hamstring, you can lie down on your stomach, stretch your knee as much as you can. You can put your head down. Just gonna keep on looking at the camera, and you just bring your heel as far as you can, and then you place gently down. It's all about doing it slow with control, and you place it down. Keep your belly button in, so you're working on your stomach. You don't have to contract your butt. You actually just bringing the leg in and out. Be careful with doing just the sort of bending and stretching. It's not that, it's really controlled. The heel is towards the sit bone, and then you stretch and relax, and in and relax. If you're doing it correct, trust me, after 15 repetitions, you will really feel that this muscle is engaging, and that's what we are targeting. So let me know how that is for you. It's more informative video than an exercise video. Next one, I will do some more knee joint as well, but with the weight on it already, so standing up and finding rotation. Let me know if there are some other zones in your body you're really worried about or concerned, or you wonder how to work on it while it's inflamed or in pain. I've probably had pain in every part of my body, and I had to deal with it and sometimes even perform with it. So unfortunately or fortunately, I have quite some experience of dealing with the pain. I hope you guys enjoyed it. Check out my other videos and subscribe to my channel, and enjoy your lovely evening, morning, day. Bye bye.